In recent years, there has been a growing interest within the healthcare literature on the connection between spirituality and health, including mental health. An increasing proliferation of articles and books describing the spiritual and/or religious needs of persons experiencing mental illness has stimulated mental health professionals to consider spirituality in their care of clients. The Diagnostic and Statistical Manual of Mental Disorders recognizes religion and spirituality as relevant sources of either emotional distress or of emotional support. Spiritual distress is a well-recognized diagnosis within nursing, yet spiritual care is often neglected in mental health care.
I think spirituality is something that we have neglected desperately in mental health care. We've seen it as a purely medical and treatment issue. We've grown beyond that to see it as a social issue as well. But one of the things that medical science is not good at doing is incorporating the language of spirituality into its practice.
This program examines the essential role that spirituality plays in mental health care. You will meet Ken, a man who has been living with schizophrenia for over 20 years. You will also meet Michelle, a woman who has experienced manic depressive illness. Both Ken and Michelle, along with several mental health professionals, will share their insights so that you may better incorporate spiritual care into your clinical practice. Mental illness strikes at the core of personhood, one's self-concept, one's self-identity, the very spirit of the person. Such an illness impacts on every aspect of a person's life.
As a person with schizophrenia, I find that basically I'm basically a transient and a shifting person. Like, I've moved addresses perhaps 30, 40 times. I've drifted through various churches and so on, and basically found myself basically a stranger in a strange land, as it says in Genesis of Abraham, a stranger in a strange land, just passing through. And probably won't leave very many people with very many memories.
There was a point in time where, I couldn't see the tree before the forest, and I felt disconnected. I didn't feel like I belonged. I didn't feel any connectedness with anything.
When a person comes into a crisis center dealing with mental health issues or mental illness, some of the key spiritual issues that they struggle with is trying to define their own self and their true self and how they can cope with situations and what they have within themselves to allow them to cope.
We know that the mortality rate in mental illness is in fact very high, 10 to 15%, and that this is through suicide. And what are the reasons for suicide? It's because people feel that they have no worth, that they have no value, that they are a burden to others, and their life has no purpose, and they would be better dead than alive. They would rather not go on with this suffering.
Basically, I made some very serious mistakes, including the attempt on my own life. I had a teenage alcohol problem. I spent 4 months in the Her Majesty's Penitentiary for an assault charge.
Persons experiencing any illness often experience struggles of a spiritual nature. For example, questions such as why? Why has this happened to me? What does this illness mean for my life? What meaning is there in this illness? What value do I have now? Or what value does my life have?
Spirituality is much more all-encompassing than religion is. And because spirituality is all-encompassing, it's about the meaning of life, then it has to do with mental health issues, because mental health is something that's gone amiss in one's life. And I find that when I work with people with mental health issues, that it's trying to help them to gain insight into who they are. I've done work especially with people with depression, and oftentimes depression is just that they have lost meaning. And if we medicate people who, you know, and if that's all we do is medicate people with depression, for instance, then it's not helping them resolve the core of the issue. Now, initially, if the depression is chronic and severe enough, then of course they need medication. There's no question about that. But as they begin to get better, the need is to begin to address the issues, and oftentimes they're issues of loss that need to be addressed, and you know, like transitions. What am I missing in life? And so those are spiritual issues. They're, you know, the fear or the sense of hopelessness. These are all spiritual issues, and they are often either related to the specific illness, like depression, or because of the mental illness, people suffer the loss of dreams, the loss of identity, the loss of a job, the loss of family. These are all effects of the mental illness, and that in itself causes sadness and causes hopelessness. And so I guess I see that mental health and spirituality are very important to one another.
Although many of the issues which Peter refers to can be issues of persons experiencing any illness, mental illness is often misunderstood. For example, a person experiencing depression may be told to get up and get going, or to shake it off. As well, a person with a mental illness may feel abandoned, not only by those they love and care about, but also by society itself. Mental illness presents some unique issues which have implications for spiritual care.
Typically, on a mental health setting, mental health care setting, where people are being treated for their illness, whenever there's any expressions of religiosity or spiritual issues, they are typically framed as a part of the pathology. And patients often will say, these are issues for me regardless of whether I'm ill or whether I'm well. And I need reassurance. I need reassurance about the fact that God exists, that He hasn't abandoned me, that He's still supporting me, to balance that other issue that I have to deal with, which is the sense of alienation and sense of being controlled by forces that they have no control over.
One of the issues which has particular relevance for mental health contexts is that of emotional and spiritual health. Both of these are closely related in that if we address the client's emotional needs, we impact on their spiritual well-being. And if we address spiritual well-being, we impact on emotional needs.
In depression, sometimes people experience tremendous guilt, which often would be described by the health professional as false guilt, or it's related to the illness. But to the person, it's very real. And typically we will reassure the person and tell them that those feelings will go away once the illness runs its course. But that's usually not very reassuring or helpful to the person who's dealing with that guilt on a day-to-day basis.
I was aware that I had spiritual needs in the hospital, but I was also aware that this was a setting where people were treated based upon their symptoms and based upon medications they were given. You know, it was very medical. It was very treat the illness, and the person is secondary to that. And you know,